It is 7:30, so let's get started.
Let's
So
do
for
it.
everyone here and for everybody watching later, I am super, super excited because I have two of my favorite podcast people with me live. Exciting. Chris and Cathy are from PetAbility, and Chris and Cathy bring more than 5 decades of combined experience in veterinary medicine and canine rehab and pet caregiver education, and they bring it to the PetAbility Podcast. Together, they form a dynamic and compassionate and deeply knowledgeable team committed to empowering pet parents, this is so many P's, with practical, uplifting guidance that improves the daily lives of animals everywhere. Chris Cranston began her career as a human physical therapist, woohoo, before discovering her true calling in animal rehab. As one of the first canine certified canine rehabilitation practitioners, or CCRP, she went on to build a career in veterinary field, creating rehabilitation services in hospitals, running a successful mobile practice, and founding Flow Dog, a boutique canine rehab center. Today, Chris channels her passion for education and connection into the PetAbility podcast, consults for Medco Vet, and continues to treat pets in their homes. My other wonderful guest is Cathy Simons, a CVT or Certified Veterinary Technician, also one of the first CCRPs, and she is certified in hospice and palliative care. She's more than 35 years in veterinary practice, including rehab, hospice, palliative care. Her career began at Angel Animal Medical Center, and later she helped establish the Sterling Impression Animal Rehab Center of New England. She has blended rehab and support for aging and medically fragile the pets. All these P's. Cathy is
So
also a
many.
gifted, I know, she's also a gifted educator, mentor, and accomplished author. She's best known for her books Blind Devotion and Watching Out for Digger. And she's a forthcoming work focused on senior pet mobility and independence. So thank you so much for joining me, ladies. I'm so excited for this. All right, so if we get started, you guys have been working together since 2003. That's a very long time. And you started PetAbility in 2020. So way before I started watching or listening to podcasts, you guys were in the forefront. What started that? How did you decide to do this and where did it come from?
I'll take that question because, as you alluded to, Cathy and I have known each other for a long time, and she gave me my start in the field of canine rehabilitation, coming from the human practice, and we had both had long and very cherished careers, but we were starting to get a little older. When you said 50 years of combined experience, I'm like, well, that just makes me sound really old. But slowing down a little bit, maybe taking things in a slightly different direction. As you know, Dr. Laurie, this is a very physical and demanding job. And so anyway, Cathy and I have gone our different directions, but we've always remained close and collaborated and so forth. And so we met socially for dinner just to catch up, lunch one day. And Cathy had mentioned that she'd been interviewed on several podcasts about her book, Blind Devotion. And she said how fun it was and stuff. And I'm like, well, why don't we start a podcast? Like we can just do that. Right. And we did. So we knew nothing. I mean, we paid, what was it, Cathy, like $29 to go to Staples. And this woman like kind of gave a 101, how to get started course and things. But I think, Cathy and I both like to talk. And so in preparation for this evening, with both of us being guests, we actually, kind of parsed out the questions because then we knew we'd be otherwise talking over each other the whole time. But I know for
Right.
me, one of the reasons I was excited to do a podcast was because I was often sharing similar information over and over and over again. And my entire career had always been, pretty much one-on-one, right? So either, me with a human being that was my patient or a pet and the pet parent. And and I'm like, how do we get the word out? Because so many people with just a few little practical tips, this one exercise can make such a difference. And so I thought if we can spread that good word to a larger audience, that would be fantastic.
Right. I agree. I mean, after years of collaborating in canine rehab, it became clear that so many valuable insights were being shared in the treatment rooms, right? And or in small professional circles. And I think we just needed or wanted a more accessible way to connect people, professionals, and pet parents alike.
Yeah, that's awesome. That's awesome. Well, and both of you are CCRPs, so you're both
Right.
very well educated. You have decades of experience, and you come from two very different worlds. You have the veterinary
Right.
technician on one side and the PT on the other. So how do you guys approach the topics you bring up on the podcast?
Good question. I think a, a key part of our collaboration has always been a mutual respect for our individual areas of expertise. So I would never claim to know as much about rehab as Chris. But conversely, I think Chris would say she would not say that she knows as much about veterinary medicine as Cathy. So this is a key part of our collaboration. We're bringing in two different perspectives. And that is balance and shaped how we learn from one another and how we approach each conversation. Um, the podcast format allows us to bring those complementary perspectives together in sort of an honest conversational way. Exploring ideas, asking questions, but also learning alongside of our listeners. So I think the respect for each other's discipline allows not only for the best outcomes for our patient, but allows for great perspective for conversation. And so I think that's key. I think the PT and the vet tech, I think perfect marriage, right? With the medicine background and with the physical therapy background, perfect marriage, best outcomes for your patients, right?
Absolutely. Absolutely. Yeah, it's a blending of both worlds. I do want
Right.
to do a call out. Robin popped into chat and said hi from snowy Ontario. Great to listen
Wow.
Hi,
about
Robin.
our. Oh, hey, Robin. And anybody else listening, if you want to pop in and say hi, tell us where you're from, what your animal's name is. If you've got questions, we're here to help. So that's what we're all in this for. All right. So to keep going, you guys, in your podcast, PetAbility, you emphasize mobility, independence, and quality of life for all the pets. How do you decide which topics and which guests are best for your community?
I would say we don't have any specific way. I think that we're opportunistic in the sense of Cathy had already alluded to listening to, the pet parents that we're interacting with, and what questions are they asking us? Because if they're asking in our practices, then probably many other people have those same, questions or concerns. But also, Dr. Laurie, we've had you on the show, I think 3 times maybe. And so when we have access to an expert and that expert is bringing something to the table that's new, and we want to help get that information out there, and we've interviewed a lot of people that have maybe a new book or new research or a new methodology, or so we want to stay on top of that and alert our listeners about these things that are out there, the latest and greatest. Cathy and I, with our experience and networking and so forth, we have the good fortune in the Boston area to have access to a lot of people locally, that whether it's my dog's neurologist or what have you. I mean, just taking advantage of all of those things. But I think primarily, Cathy, we just try to be very open and listening. And people have also solicited from us, now that you talked about, like, we kind of got in the ground floor, but now podcasters have people that go out and approach other podcasts and do you want to be, would you like to interview X, Y, or Z, and
Yeah.
that sort of thing.
Right.
And so anyway, we're happy to support anybody, and we want to have very good information that we put out there.
People are starting to
Excellent.
reach out to us, which is always so cool. But when you asked that question of Chris, I think my first thing that came in my head was our tagline. We want to help pets live their best lives. And to do that, we need to get top experts and people and share and communicate and get on the air for that to happen. So, fin, feathers, or fur, we're down for quality of life, mobility,
Right.
independence. That's what yeah.
And I
That's
think,
awesome.
when we started the podcast, we just started our 7th season. So yesterday we published episode 1 of season 7. So we have over 150 shows out there. And
Wow.
most of it is brand new content. We have done a few rewinds, bringing back some popular topics and things like that. But every 2 weeks, we put out a show. And we started very rehab focused because that was our area of comfort and expertise, right? But now, again, over the years, we have expanded to a lot of other ancillary topics that we think our listeners would want to listen to, learn about, have gain insights regarding, or that's just helpful to them.
Yeah.
So
All right. So I do want to call out, I see Dee is here. Hey, Dee, so good to see you.
a lot of talk about the weather.
Yeah, I know. Hi, Anna Marie. Hi, Robin. Yeah, lots of people freezing. And I get the freezing in Ontario. It should not be freezing in Florida, right?
Yeah.
So give all the puppies a hug for us. Tomorrow, 21 degrees. Woo, that's cold
In
for Florida.
Florida.
Yeah, that's crazy cold. And Laura's here and Leslie. Awesome. Hi, guys.
Kathy and I are in New England, and I was just going to say there's always a mass exodus, right? Every winter to Florida. And I talked to somebody yesterday in Florida, and she was preparing for this. It's 21 for this cold weather coming in. So, but yesterday she was talking to me outside, and I was envious.
Yeah. Laura just piped in. Ontario is minus 21 Celsius tomorrow.
That doesn't
That's
even
really
make
cold.
sense.
Ouch.
I can't even fathom that.
Yep.
Minus 21 Celsius. I mean, minus 21 Fahrenheit is one thing, but Celsius is, I think it sounds like Mars.
Hi, Shondell. Hi, Sarah. Hi, Michelle. Yay. Everyone's saying hi. Pneumonia weather for sure. That's right.
Oh,
People take
no.
care of yourself.
Ooh.
Absolutely. All right. So, Cathy, can you
Mhm.
share a special story that highlights the impact that PetAbility has had on pet parents? I'm
Oof.
sure the
Okay.
one right in touching your
Just
heart.
keep just keep it to one. Okay. All right. Um, well, I guess when you say that, what I think of is that, Chris and I are big fans of the underdog, right? And we like to showcase differently abled pets. And we do that because we want to show the audience that just like humans, pets come in different shapes and sizes. And sometimes they use wheelchairs, and sometimes they're blind, and sometimes they have a limb amputation. But the important message is that those pets have value and they can live interesting, joyful lives and be incorporated into a loving family.
Mhm.
And the more we talk about this, the more we normalize the cat with cerebellar hyperplasia, the dog with the prosthetic limb. Um, and people are starting to think about it. And so the thing that's the most memorable for me is when people reach out and say, "Hey, Cathy, I listened to your show on living with blind dogs and I incorporated these techniques and things are going great." Or somebody says, "I listened to your show on mobility carts and I'm thinking about adopting a dog in a wheelchair." It gives me, I bet it's giving me goosebumps to think that there's a dog or a pet out there that may have been saved or adopted or brought in and loved by a family who may not be, they're perfectly imperfect. Maybe they don't have, maybe they don't have four limbs. Maybe they have one eye. But just educating people on those types of animals and showcasing these
Yeah.
dogs doing great, fun things and doing
Uh-huh.
regular dog stuff, right? Is probably the thing that impacts me the most is when somebody says your show really changed the way I think about living with either a physically or sensory impaired pet. So that really gets me every time.
Well, I don't know if you know this, Cathy, but I had a golden retriever who had osteosarcoma in his carpus and
Mhm.
being a rehab vet. And this is 15, 17 years ago. We did a partial amputation and we fit him
Yep.
for a prosthetic. And
Nice.
we had him for 43 months before the cancer. He was 15 and a half when we lost him.
Wow.
Right.
It was just amazing. And I
Yeah.
learned so much. I mean, I think all of our pets teach us so much, but he would run in the snow with his little prosthetic. He would rub on his back and play and stuff like that. It was just an amazing thing to see. And he taught
Yeah.
so many people really cool
Right.
stuff.
And maybe change someone's mind about living with a
Yeah.
dog that had a prosthetic, right? Or a limb
Yeah.
amputation and change their mind about about these dogs and or cats, about how their lives are, they're just living their lives, right? They don't care if they got three legs. They're just living their lives.
Oh, yep. All right, so we say hi to Ernest. Thanks for joining us. And we have Mariana from Mexico. Woohoo! We
Ooh,
have Dee, Transylvania Love and Hope is in here in need of a wheelchair. Dee is a volunteer. Yes, Dee does amazing things. Um, and I do remember you working with the wheelchairs with Tyson's. Very much so, Dee. Let's see what else. Michelle says, hi, Dee. Robin, it's an honor to save, restore, and help a challenged dog. Absolutely, Robin.
isn't it?
Abs. Yep. Yep.
Yeah.
I
I've
often
had,
I often feel
yeah.
that the dogs that have more needs, no
Mhm.
matter what it may be, physical, emotional, but those are the ones that over my lifetime I've grown the
Right.
closest to.
Yeah.
Because you're so intimately involved in their care, and it's mutual. I mean, they need you, but then you need them. And like you said, Dr. Laurie, you learn so much from them. And oftentimes the biggest lesson is just to slow down and listen. Yeah. Yeah.
Mhm. Yeah.
So yeah, it's awesome. And I often share with folks when I'm talking to them too. I'm like, you're my people, so I know everybody here
Right.
tonight listening. I mean, we're like preaching to the choir, right? It's like you
Right.
all get it,
Right.
but it's nice to be, validated, and sometimes we live in our silos, and don't have like personal contact with a whole lot of people out there. And so we now have the entire North American continent covered because we have Canada, US, and
Right.
Mexico, and we're all bound, I guess, by our mutual love of pets. So
Yeah.
hello.
Oh, there's our
Oh, it's
friend Christy.
Christy.
Hi,
Christy,
Christy.
yeah, Christy here. Yay.
Nice to see you,
Very
Christy.
And
cool.
I've known Christy for a long, long time. She is great. She got certified in fitness, and she does agility. And one of her border collies is a beauty in the beauty pageant circle, she says, which is just kind of
Ooh.
hysterical because she never
Oh.
thought she'd be one of those. So she isn't the primary handler, but I guess that Lou has some pretty good stock there and struts her stuff.
Nice. Very cool. Very cool. All right. So you guys cover a wide range of topics, all the way from body work to cognitive dysfunction. What are some most surprising things you've learned while hosting Petability?
Kathy and I were going over these questions, and we're like, wow, these are tough.
Yeah.
Um,
I have one.
so
I have one.
okay, go ahead, because I was going to pivot just a little
I,
bit.
I have one. As I was thinking about it, I was thinking how I'm continually amazed by how much pet parents underestimate their own impact. So, time and time again, guests have shared stories and education and awareness, and have made a big difference. So, when I think people understand what their pets are experiencing, they become better advocates, and that can be truly transformative. So, I'm always surprised that people don't take their own credit for how much they do and what an impact they have on their pets' lives.
And sometimes it can just seem so minuscule, it's
Right.
just a slight little adjustment, or the laying on of the hands, or when I say adjustment, meaning like maybe in their lifestyle, elevating that bowl, providing traction here or there. And you're right, Kathy, the pet parents don't give themselves credit. And I think it's part of our job to point that out to them. And
Right.
once, you start connecting the dots, then you realize how much value you are bringing. Because I think a lot of times there's a feeling maybe of powerlessness, maybe hopelessness, depending on the diagnosis, or age of the pet. You start doing that anticipatory grieving and so forth, but you can still have so much impact. And what I was going to say is, kind of turning it the other way around, is that I consider myself a lifelong learner.
Mhm.
And I love when we interviewed guests, and every single show, I think I have an aha moment, you know, and
Oh, cool.
having done this for over, 22 years, there's always a little nugget in there, and I'm learning something new or thinking about it differently. Maybe I've been doing this, but I didn't realize, like our pet parents, that, oh, this is actually affecting the fascia, for example, or, when
Right.
I'm thinking about it in a whole nother way, so that's always very, very exciting to me. You know, we never want to be complacent, as pet parents or, working in, the veterinary industry. So there's always something to be gained, I think. And, yeah, so I think we all should keep striving to learn more and find those
Yeah.
aha moments. Yeah.
Oh, yeah. I always explain to people, like, I am such a research nerd. There are many a day that I'm listening to research in the shower, right? Or as I'm brushing my teeth, just keep
You're taking
learning.
advantage of every moment.
Yeah.
Wow.
Yeah. Yeah. There's no downtime. All right,
Mm.
so hold on, let's see. Dee says, I just wish people wouldn't wait so long to get help with mobility when pets start going down. A vet needs to be more informed on what's out there and therapy and other modalities. And Dee, I agree with you 100%. I tell my clients all the time, that is why I teach. They'll be like, but Dr. Laurie, well, why didn't my regular vet tell me blah, blah, blah? That is why I teach. The more
Right.
people we can teach, the more animals we can help. And that honestly, that is my tagline, or what I live by, is empowering people, optimizing pets. Right? The
Right.
more I can teach, I literally tell my clients, the more I can teach you, and I say this lovingly, the more you can do at home, so the less I have to see your pet, not because I don't want to see you, but that gives me time to help somebody else.
Yeah.
And I only have
And
so
there are
many
Yeah,
not
hours.
enough
and
of, I
yeah,
was
there
just
have
gonna say,
been
there are
many
not enough of
times.
us out there.
There have been many times I have gotten a client in the exam room and had them tell me that their vet has told them their pet is simply too old for rehabilitation. And I would argue, of course, that age isn't a disease. But remember, I work in hospice, and so I see a very fragile population of animals. And I think that there are many things, and very, very many gentle things that we can do with our senior patients, like Dr. Laurie, like with the tuning fork, with
Yeah.
fascia work, with hands-on, with massage and range of motion. There's so many things that can be done that are very gentle
Mhm.
work. And so I would argue that senior dogs are probably some of the best candidates
Yeah.
for rehabilitation. Yeah.
Well, yeah, and I would go even further to say, we're not here to help the healthy ones, right? The regular can
You
do
never
that.
see them.
Right, right. And don't get me wrong, I love working with my sporting dogs and just making them the best they can be. And we have the biggest effect on the ones that are the older or the broken or the having multiple issues, right? We can see the biggest effect in them, which is what fills our cups, right? And it helps
Right.
us do the physical work, get down on the floor, get them moving, sometimes when we're tired, because we know we can make an impact in their lives.
Right.
You guys
And
are
I
great.
agree that's the biggest impact, but I'm also a huge advocate for prevention and wellness.
Oh, yeah.
Mm.
And, I
Yeah.
remember, back in the day, well, we think about insurance, right? And, now more and more people are getting pet insurance. And I just hope, because that's one of the reasons I pivoted from being a PT with people, was I didn't want an insurance company practicing medicine and telling me what I could or couldn't do. And,
Yes.
it's often not paid for. And that's challenging for folks. But when I had my own practice and I could make the decisions, I, invited pets to come in and swim and do, proprioceptive exercises and periodically get their, hands-on work, which is much more than massage. I mean, massage kind of gets this bad name, but we're doing so many techniques simultaneously.
Mhm.
And that when I've had the luxury of providing that to pets over the years, I was just at a Great Dane's house and she goes, how long have you been coming? In my mind, I'm thinking like a year or two. It's been 4 years. And she's a senior Great Dane and she's rocking it. And I think that if
Awesome.
I wasn't doing those regular visits, she
Oh,
she
yeah.
wouldn't be doing it as great. So yes,
Right.
impact, on the seniors and the very broken is huge. It's very objective, measurable. You can see the changes, quickly. But I think we have to trust in that prevention component too. And I'll just say this: I have my own knee injury now that I'm dealing with, And I'm realizing, like, again, I always say this, like, if somebody was watching me at this point in time, they probably wouldn't have a clue that I'm injured. I have a lateral meniscus tear with a little floating thing going on there, but it was, like it would be 10 out of 10 pain at times. And, this could lead to, arthritic changes down the road and things like that. I can describe that to my doctor. Our pets can't. So again, it's up to us, just based, statistically on their age, the breed propensities that for given injuries and conditions, and helping our pet parents navigate that and prevent some of those things from getting so severe.
Yeah.
I'll get off my soapbox.
Prevention's huge. And prevention's huge for more than just the sporting dogs. All dogs. People will frequently say, well, when do you start supplements, right? And it's like, well, if it's a sporting dog, I start between 6 and 12 months. And if it's not, usually around 2 years of age. Why wait until they have clinical signs and they're painful to say, oh, now we're going to fix it? Let's prevent the problems, right? And exercise is huge. Let's get everything stable so we don't blow that cruciate or that shoulder. Yeah.
Right.
Now
I remember listening to your webinar and I forget her name, the expert that you're collaborating with about cruciates, and again saying like the disease, and the disease process happening, so much earlier than the clinical signs are recognized. So again, as a person, we can say, oh yeah, I feel, my knee feels like it could give way because there's a little bit of swelling in that's hardly even detectable. And, I that hurts when I go downstairs. Our pets can't tell us that, and they're going to ostensibly look normal. So Dee, I love all your comments. You're a very active listener.
I know. Dee has 2 of her kids with CCL tears. Ouch. I have whole lectures on how to prevent those, and just gave them at AVMA. And we need to stop letting dogs have that happen. And there's so much we can do to help them. But that's another topic, another day.
Yes.
All right. So, yes. There's so many topics, right? So dog mobility and independence can be complex. How do you balance between the science and the simple explanations to keep your content accessible and actionable for your pet parents?
I would say we rely on experts to explain the why. And Chris and I will focus on translating that information into sort of practical takeaways, right? So often you'll hear one of us say something like, so what should the pet parent look for at home? Or what can we do to implement this today for your pet? And Chris will often summarize those because we do talk about a lot of complex topics, mobility, neurological changes. And we want to leave the listener with something actionable rather than being overwhelmed with information. So we try to have a nice, healthy balance between what the expert is saying and sort of translating it a little bit.
Nice. Very cool.
I think that we can have very, very, very educated expert people. And, we all know that the ability to communicate and connect varies broadly. I think we've been very fortunate in the approachability of our guests, but I always tell them when I invite a guest on, pretend like you're educating a pet parent in an exam room. Or if it's a researcher, you're explaining what you do to your sister or your mom, or, that may not have. And so, like I said, even me, even though I may understand some of the complexities, I still try to make like analogies, especially to people, because I think if we can relate it to ourselves, and as a PT, I think I'm pretty good at that, then it helps you to understand. And I think we're horrible. So many professions are horrible at using acronyms. And so I always try to, we just throw it out there, TPLO. Well, what is that? And so not only saying what the letters mean, but also what it looks like, for example. So, kind of, I don't want to say dumbing down, because I think that our audiences are getting just smarter and smarter and smarter. People know a ton. And I think, the internet, chat GPT, has a lot to do with that, because people are doing their own research and looking things up. And, you hope it's valid and reliable information, but they're getting more familiar with like terminology and the, you know, procedures and things out there. But yeah, I think that we both also draw on our own experiences with our own dogs, Cathy, to make it relatable. You
We're
know,
pet parents. We're
and we
pet
try to
parents
be
as well.
yeah.
So we can relate to what people are going through. Yeah.
Yeah. And we try to create an environment of approachability. You know, it's a conversational podcast. You know, it's not strict Q&A and, you know, super didactic and, you know, that sort of thing. So anyway, we've gotten good feedback.
So speaking of teaching, can you guys tell me what are your top three strategies for improving comfort and function in our aging population, pet population?
You want to go
Cathy,
first,
you can
Chris?
say the first one. Oh, you can go first.
Well, here's the thing. I love pets' feet. I think that I'm going to make a bold statement here that in terms of mobility, the foot should be considered one of your dog's greatest assets. And with that, we need to have good foot care, good toenail care, and good traction, good surfaces. And if you think about the foot, and I'm going to get excited because I love the dog foot, it's amazing. And I'm in awe of its structure and its function. It's made so durable that it can traverse rock and sand and snow and cement, yet so sensitive that if you just touch it like that, they'll, ooh, you've tickled them, right? So it's amazing because, you know, each step with your foot, the brain is getting information from receptors in the foot, and it's telling the body how to respond to the environment. So foot care, foot care, foot care. Dr. Busby's toe grips, toenail length, and good foot care. Thank you.
All right.
Thank you very much.
So before you get to number two, I just have to say I looked over and almost died laughing. Peg said, analogies in Florida, it's cold when they warn people to watch for falling iguanas.
Oh my gosh.
Oh my gosh. Can you imagine getting knocked out by a frozen iguana?
Wow.
Oh my goodness. I almost kind of want to see that. Yeah.
So again, before we go on, Michelle says, can you say what nail trimming tool you recommend?
Oh,
it's right here. Hold on.
I use the orange handle ones that we sharpen.
Yeah.
It's just great control for getting the sides and
the one
the top.
I use too.
Right. And then it depends on the patient. Sometimes I'll follow that with a little Dremel if I can, if they'll allow it. Yeah. To sort of get that right.
There's a specific brand.
And toenail length is important. You know, if they're too long, they're digging into the ground and then they're rocking back on their feet to make room for those nails. And you're getting faulty information from this. And you're contributing to an osteoarthritic, you know, that constant trauma is a factor in arthritis. That's what we said, Chris.
I'll do the nerd thing and say, we know that if you can hear the dog's nails when they're walking, that is sending a message to their brain that they're going uphill, and it changes their posture and actually causes lordosis. Yep. And
see, this is my aha moment.
And literally, I've had dogs where they come in and they're severely lordotic, and we trim their nails, and immediately they get up and they're less lordotic. Not to say they're perfect, but they're significantly better.
Yes. So somebody asked about nail trim. I think you have to have some skill and experience. This is the tried and true veterinary nail trimmer. You know, they keep trying to come out with things that are better, safer, that are tolerated. You know, Cathy and I have talked a lot about fear-free grooming, you know, introducing things. So because you're investing in a lifetime, and if you injure your dog's nail when they're a puppy, they're not going to forget it. I mean, then you have to undo everything. But this brand, which is indestructible, I think I've had 2 in my career, is called Miller's Forge, and it's made in Italy, and it's stainless steel. So they don't get dull quickly, and you know, so they make a nice cut. And anyway, that's what I use. Okay, can we go on to the other things we're excited about, Laurie?
There's some questions.
Yep,
There's
we
some
have.
questions.
Are you going to address red light or in-home laser therapy? There's so many on the market. And have people asked about micro trauma from using the trimmers you use? There's misinformation on the internet. I like to trim nails prior to a walk. That way it's less traumatic for the dog and the sidewalk will trim away any burrs. Nice.
Yeah.
So
Yeah.
let's hold on to the red light until we get there. But then do you have any comments on micro traumas from using the trimmers?
I mean, I think that exists. I'm curious the
Yeah.
specific misinformation that the audience member was referring to.
Or I would say,
Um,
yeah, I mean, because I know to me, it's super, super important to hold on to the toe so that when you go to cut, you're not twisting the toe or torquing it or anything like that. Besides just cutting it too close and quicking them. So I don't know if
Yeah.
and
that
it's
puts it.
really hard,
Else-
like if they have hyperreflexia for any reason, and so if you could do it and have a helper, I think that's
I
also
And I
good.
try not to, I do what Dr. Laurie does. I stabilize the toe, try not to push into the nail because I don't want to push the nail into the nail bed because I think that can create micro trauma. And then micro trauma leads to, you know, osteoarthritic changes later down the road. So I try to stabilize when I can. I do the smart thing. I have a groomer and she's a fear-free groomer and I drop my dog off there and she does it there. And I have a pug, so I mean, I don't want to say anything disparaging about pugs, but traditionally they're not that great for nail trims. But she's a fear-free groomer, and she's worked really hard over the years to acclimate him to getting fear-free nail trims. And so he'll consent to nail trims with her. I've been forbidden to do it. Like groomer.
So I can tell
Because
you with our dogs, we do nail, a dab of peanut butter, nail, a dab of peanut butter, right? To make it a
Let me see.
positive
Yeah.
thing.
Let me
And the
see.
other thing, yep, I would recommend is if you've got a little dog, holding them like a football. So the legs are just hanging down and they're like, what's going on? And then you can trim them. Think
and they
more
kind of just
about
relax.
where's the ground. Yeah, they're just like
Yeah.
hanging there and they're more
Yeah.
relaxed doing it. And
Yeah,
Peg,
they have those contraptions now that hang the
yeah.
dogs. Yeah.
I've never seen it. Yeah.
I just want to say, because Cathy and I, with our show, we're trying to get good information out there. And we are a huge fan of Dr. Julie Busby. She is a friend of
Yeah,
ours as well.
adore her.
So,
Mhm.
the toe grips for traction, but she also has a whole tutorial. If you go to, she's changed her name. It's Senior Dog Company, I think now, Dr. Busby Senior Dog Company.
Yep.
But anyway, like a PDF on nail trims and things. And one of the key things that I learned from her was actually the angle at which I cut. And then a vet tech taught me about kind of trimming a little bit from one side, a little bit from the other, a little bit. And boy, that works great. You never just want to whack a whole hunk of nail.
Yep. Oh, here we go. Dr.
Busby's
Busby's Dog Company.
Yep.
So and I always there's a
no one is more passionate about dog toenails than Dr. Busby. There's no one.
Yeah.
Yeah. She has a lot of great resources on her website and things
and
too.
She's
So
genuinely a really wonderful person.
Yeah.
So I'm chomping at the bit to tell my things that I.
Yes, let's go to number 2.
Excited about.
Go ahead.
Okay. So as a PT, physical therapy it is always about, and we've already talked about it a little bit, but moving, right? And again, we adjust for injury, we adjust, maybe for age, or whatever's going on with them. But I'll tell people, like, even with their cats that sleep 22, 23 hours a day, encourage them to follow you from room to room, have beds in different rooms and things. So they're not just lying in the same bed, in the same place, all day long. So, movement doesn't have to be, going out on a 5-mile hike, so again, kind of pointing out the little daily things that pet parents can do. And oftentimes when we're talking about movement, then that correlates to enrichment. And Cathy and I are both so much about enrichment. So many times these things are connected. And so, again, I try to point that out to people. I'm like, yeah, in your mind, you may think that you're taking them out to go to the bathroom, right? But I may build in some time so they can sniff rabbit poop because they see the world through their nose, and walk on different types of surfaces because I have pea stone, I have sand, I have grass, I have all different kinds of surfaces. And again, that input. So you're doing all of these things, mind and body. And so anyway, so you can see how we
So
get
important.
passionate, Laurie.
Yeah, I know, we get excited.
Laurie, Dr. Laurie.
I think about it in a couple of ways. I think about movement externally, and the ability to have independent movement gives the dog freedom to get a drink, go to the bathroom, move into the shade, sunbask, gives them a chance to go upstairs, greet you at the door. Conversely, it also gives them the opportunity to move away from something that they think is, unpleasant. And internally, movement plays a big role in body function. Like Chris said, every step engages muscles, tendons, ligaments, preventing muscle atrophy, bone loss. And again, we talk about those receptors. Everything is information for the brain as you're moving, and cerebral capacity increases. And movement is working synergistically with the circulatory system and blood flow and getting oxygen and nutritions to the brain, and clearing the lymphatic system. So movement is so crucial to overall health and well-being. So it all plays
even
in.
Getting the bowels to move,
Right.
things like that, and
metabolism,
proper
right.
digestion, that all happens through movement. If we're in static, then everything kind of goes stasis, on the inside.
Yeah. Yeah. Or even just releasing endorphins from, moving around. That helps with pain. So movement is so important. Yeah. And then
So
Chris,
we've got
I got
movement.
And then environmental enrichment was the third.
Yeah, I said two of them kind of together.
It's the key to the spice and joy of life.
Yes.
Right.
Yeah, it's super important. Keep that, whether it be a snuffle mat or a puzzle or something to keep the brain going.
Right. My pug does nose work, and he's actually so good at it that he's gotten his odor recognition title and is competing in
Nice.
NW1. And I've had people come up to me, judges even, and say, thank you so much. We never see pugs out here on the nose work course, but there's no reason that they can't do it. And he's just as good as everybody else in his class. And that is his biggest environmental enrichment. He could find birch, anise, and clove wherever you put it. Or a sandwich or a hot dog, but also birch, anise, and clove. But it's so enriching for him, and to see the joy it brings him, and that brings me joy, and that it works, and it helps us with our bonding relationship. It's that human animal bond, is to see him working through these problems and solving them, and me going, yes, you're the greatest dog I've ever seen.
Yes. Yes.
And he believes it.
And Robin says, my adopted adult German Shepherd dog has flatter than average carpals bilaterally. So common in German Shepherds. We walk daily and incorporate hills on alternate days, weather permitting. Any suggestions? I'm going to throw that one in. I highly recommend getting a peanut ball to start and having the dog put their front feet up on the peanut ball and walking it forwards and backwards so that they're using all the muscles, tendons, and ligaments that support the wrists, yet most of the way to shift it to the back. And then once they get stronger from there, then we have them even just holding it, right? Because then they're using their trunk, their back legs, and they're using again, all of the support structures. And then we add, okay, now that you can hold it, walk sideways around it. And this is all with the dog holding the ball. To go backwards, the person has to move the ball. But other than that, the dog is in control of the ball, and that really works everything best. Yep.
Yeah, and I even encourage things like having chew toys and puzzle toys and things like that. So they're gripping and holding, that. So they're getting the enrichment and whatever, but they're also engaging those flexors, which are opposite of this passive, extension. And then I love walking in like softer surfaces too, because I think they use more flexion. So whether it's softer sand or grass type of thing, staying off of concrete, really hard things, and digging, some dogs can be trained to dig too.
And it doesn't have to be
in blankets, like finding their,
getting the laundry, taking smelly treats. What I do is I'd say, get a smelly treat, put it in a Ziploc bag so it doesn't destroy your clothes, right? cut a couple holes in it so they can smell it, and then have a handful. Because as soon as the dog starts to dig, you throw one down and they're like, oh, I found it, yay. And then they start to
Oh,
put one in a bag, and then you throw another one down, like, wow, it magically appeared. Right. So
that's
that's one way I get
amazing.
to dig.
Yep.
Um,
Yeah.
and
See, we're
I'm just
we're
laughing
all
because that's my dog. My dog's like,
in
Peg
these
said they
little
move more
practical
when they're
insights.
warmer. Oh, yeah.
Mhm.
Yeah, yeah, yeah. Yeah. From doing this for how many years,
Mm.
right? We learn
Yeah.
all kinds of
Yeah.
crazy things. Peg says that they move much better when they're warmer. Absolutely.
oh yeah.
Uh,
We
right.
do too.
Getting a K&H
Yeah.
bed, right. And I have
Yeah.
clients that I will tell, get up in the morning, throw a blanket in the dryer, go take your shower, get out of the shower, put the blanket over the
Nice.
dog. That's warm. And they warm up. And then by the time you're dressed, they're like, okay, now I'm ready to move.
Yeah.
Mhm.
We're
Yep.
gonna go
Yeah. And
out
I
and look
think
for
with
frozen
arthritis,
iguanas.
Yeah. Right. Right.
you make them little thermal coats or something. Um, but yeah, I think with older dogs and arthritis, with that stiffness though, the warmth is so much more valuable.
Yeah.
And and then of course, again, we don't even think that we're snow for a soft surface, that we're
Yeah.
even doing warm-ups a lot of times when we are. So again, telling the parent the value of, so you do that little walk, or like Laura, you were gesturing like the little vigorous rub to get the blood flowing and things like
Oh,
that. Some parents just do that by habit, but they don't appreciate the value of all those little things you're doing throughout the day. I think that's the theme of this
yeah.
conversation.
Yeah, the little things. Yeah. And Laura just popped in back on track jackets. Absolutely. Help keep the blood flow. Yep. All right. So you guys both work in clinical and community settings. How has that influenced the way you talk to people in your petability community?
Again, tough question. I guess
Mm.
hopefully you've kind of seen in this conversation tonight that we both kind of have our own styles, right? We've talked over each other many times despite our best efforts, so we both love to share and so forth. But I think for me as a PT, and I'd already said this before too, like making those analogies, the combo, and talking to people about, what happens in the human world, and this is analogous in the dog. And I just think that makes it so much more relatable, and I see people get those aha moments.
Mhm.
So yeah, and again, personal insights, and like for me, it's a PT background, and Cathy, I know you've had an extensive background like in radiology and things like that. So we both love anatomy, and I love statistics, and I don't know, we just
She does love statistics, yeah. That is true. I think my clinical background helps me recognize when a concern needs professional attention. And it gives me the language to ask clarifying questions or gently redirect a conversation towards evidence-based information or direct them back to, basically to their veterinarian. But at the same time, my experience in the community reminds me that people don't always show up looking for answers. They're often looking for reassurance and understanding and connection. And so for that part of it, I try to create a space that people can share their experiences, while sort of setting the clear boundaries around misinformation or one size fits all advice, right? But also allowing them to have their experience and share that with me.
Great, great. I want to pop back in. Thank you, Laura, for reminding me. You had asked about red lights and lasers. I love them. I use them all the time. There's more and more research coming out about red light. I'm reading up on it. Um, I know that laser can go into the joints. I've read thousands of research articles on it. We have our at-home laser therapy course for pet parents, and we have our Optimum laser therapy course for professionals to teach them how to use it, because I was one of the people that started with it, looking at the research and using the lasers for 20 something years. So I think they're amazing. And I highly recommend getting a good one. 100% honesty. I am sponsored by SpectraVet, Respond, and Avant. and I recommend all of them. So I'm sponsored by them because I really appreciate them. There's some really bad ones on the market. Their diodes don't, some don't have diodes, some they shut off and you don't know they shut off. They break very easily, so you have to be very careful. And Chris, right? You work with MedcoVet, which
Kathy does
uses
as well
like,
now.
yeah, yeah.
Yeah. So
Excellent. So you want to pop in on that?
yeah, and I appreciate you disclosing, who you're sponsored by. I had the privilege of meeting the founder of MedcoVet when I was selling my business to Angel Animal Medical Center in 2018, and I didn't know what my future would hold. So I said, "Hey, if you have any, thing," because I was really impressed with the product,
Yeah,
and this
yeah.
was fairly. I've been using, and Kathy and I have used lasers in the clinic for a couple of decades now, but more and more people were saying, "Hey, I got this, online. What do you think?" And I would say, "I have no idea." How am I going to dissect it? I'm not an electrical engineer. I'm not, and there's so much propaganda out there. But in establishing my relationship with Alone Landa, I realized, that this is a great device. And it was my patients liked it, the pet parents liked it, and the patients were getting better. And so, now Kathy and I both do consults for them, and their whole niche is providing a good device at a good price point. I mean, it's an excellent device, clinical grade, but safe for home and easy to use for pet parents. And, speaking of PetAbility, that was the first podcast of 2026 was we interviewed Alone for the third time. And so if anybody's interested about, the MedcoVet Luma, please tune in there. But there's a lot of great information again on their website about red light therapy, contrasting with the over 600 devices that are out there, on Amazon, as well as clinical devices. And, clinical devices work, but sometimes it's hard for people to access that as frequently as could be beneficial. So anyway, a lot of different variables and things to consider.
I would say look for companies that have research. One of the ones I've had clients ask me to look up was HelioVet. And
Pet.
yes, thank you. I have a hard time with a company that says you should use the same amount of energy for a hip, which is super deep, and skin, which is super shallow, and a different amount of energy for the knee. Right? Just
Custom
pulling something like
protocols
that off the
are important.
website is, right? It's just, there's wrong. It's just wrong. And Robin asks, how often can a laser be used? I will tell you, I have because lasers are FDA approved for humans. My son had his tonsils out, and I lasered him twice a day for 3 days. And it helped him tremendously. When he had all four wisdom teeth out, I lasered him twice a day for 3 days. If I have a dog with arthritis, would I do that? No. But for an acute big issue, I mean, I can remember telling my son after he had all four wisdom teeth out, Jamie, take some pain meds. I need to get some work done. And you're running around like crazy. And he's like, I don't need pain meds, Mom.
I feel
Just
great.
give me that laser again. Right?
Yeah.
And I'm like, 18-year-olds. Yeah. Oh, yeah, here we go. Respond has a 2400 VS, which is great for pet parents. SpectraVet has the Zeus for pet parents. Avant is coming out with a pet parent one, and MedcoVet. Those are the ones I recommend for
Luma.
the Luma. Yep.
Yeah.
Those are the ones I recommend for pet parents.
And as far as the Luma goes, just be very, very careful, because now there are a lot of, I will say, imposters
Luma.
that have used variations of Luma, right? So there's
Yes.
Luma Soothe, Luma Arc, Luma Pet, Luma, so again, do your research. People are, and it's amazing. Again, Kathy and I do these, what's the word I'm looking for, Kathy? Veterinary.
We do these direct
Well, we do consults, but it's like telehealth, televet consults.
And so, yeah, and I tell people, I think it's so hard to wade through, if they go on Amazon, my goodness, they'll never come out. But I think that, some of the takeaways are, yeah, you want to work with a company that's transparent about their specs, their wavelength, and their power. If they're not, then that's not for you. I lean
Right.
away from products that say that you can use them on your pet because I think it doesn't account for fur. So I don't know that you'll harm an animal with using it, but I'm not sure you'll get the outcome that you're looking for. And I also don't pay extra for extra lights because I don't see any clinical evidence for purple and yellow and green. So sometimes I see devices that say red and infrared, but for extra money, you can get these other lights. But I haven't seen any clinical evidence to support that yet. And so maybe 10 years from now, purple will be the thing. But right now, I don't know that it's a value add. So it's hard to wade through. I agree.
There is research on the
That's a
different
hype.
colors for
Is there blue?
antibacterial issues.
Blue. Yeah. Blue.
Well, blue you have to be super careful of. Blue causes cataract.
Ah,
So that's why you wear your blue blocker glasses when you're on your
yeah.
phone or your computer.
Yeah.
So you have to be careful with blue. There's some research on blue that it stops ATP production. So it may be um, um, there are some detrimental effects with blue. I know they use blue in dental work, but it
In
takes
microbial
90 joules per
stuff.
centimeter squared. It's a lot of energy, but
Mhm.
using a lot of energy will actually kill all the mouth bacteria. So there are uses for blue. Blue is really good for MRSA in humans, but it does
Hmm.
not do for MRSIP, which is the equivalent in animals. So
Hmm.
and then the question from Marnie is photonics LED light therapy. That is red light. Red light can have an effect. There is more and more research coming out on it. I know I had somebody to my house who had a photonics device, and one of the things she said is when she gets sick, and she was a very smart lady, not a vet, but a smart lady, she would put it on her jugular and her carotid for 15 minutes on each side, and it made her feel better. So that's an N of one, right? So, right? But if somebody says, hey, this works for me, who am I to say it's not? So I think, and certainly for photonics, for acupuncture points, absolutely, right? You don't have to go very deep for
Mhm.
acupuncture points. And there is research that shows that LEDs can stimulate the acupuncture points because you don't need a lot of energy. So that's certainly an option. Okay, and then Patty says, my rehab vet just recommended shockwave therapy. Excellent for your 12-year-old lab mix. We think he has some arthritis in the hips. He has some hind end weakness. It seems to have gotten worse in the last month. What are your thoughts on shockwave? It's excellent. I don't do shockwave, but I have Janet Methvin up in Asheville. So when I have a patient that I can't control everything with my laser, I send it up to her.
Okay.
So yeah.
I think some like with all these modalities and things, oftentimes what's recommended is what's available. Um, and don't be afraid. I think the take home is, that you do have choices and don't be afraid to explore those different choices. And many conditions can benefit from multiple modalities, like arthritis, a multimodal approach. And
Yep.
what works for patient A that has the same diagnosis, they're a black lab that weighs 65 pounds and may not work for patient B that's also a black lab, weighs 65 pounds and has the same diagnosis. We, again, as people, know that we each respond to different inputs differently. And,
Yeah.
even medications, right? Like, I do great with ibuprofen, not as great with Aleve, and somebody else may, do better with Aleve. So I think oftentimes, even in the human world, like whatever our doctor says, we're like, okay, you know, that's what we'll do. But ask
What it-
questions and, don't be afraid to share. I don't know if this is helping as much as it could. Can we try something else? Or,
Yep.
yeah, shockwave's great, but I heard that, red light therapy or laser's great too. Can we add that in, and just see where you get the most results. And sometimes you have to throw in the kitchen sink and then, start paring things back. But
Yep.
I
Yep.
wish it
And I
doesn't,
don't,
I wish it didn't have the word shock in it, though. I think it scares clients that it says shockwave. Um, but it's actually so much more than the newer devices. The newer shockwave machines are so comfortable. I tried it 20 years ago when it first came out, and
Oh
I
no,
was
it's
like, nope,
horrible.
nope. I felt like I got punched repeatedly. But with the
Yeah.
newer device, it's so comfortable and so effective. But I think the word shock maybe might scare clients a little bit, but it's not
No,
shock.
And
We're
it's
not
sound
shocked.
waves,
keeps you awake,
sound
It's
waves.
right?
sound
Keeps
wave,
you
not
awake.
shock.
Yeah, it's
Yeah.
another type of acoustic therapy, like the tuning fork.
Right. Right.
And I don't want to drop off on Robin. She said, how often with the therapy for chronic conditions? My rule is to get rid of the pain and then spread it out. So we're talking about laser again for just a second. So even if I have if the dog is in my house, right, and I have a dog with arthritis, I would start with daily for 3 or 4 days, go to every other day for 3 to 6 treatments, and then go to twice a week, and then spread out as able. But that should at least give you an idea if you're going to be doing it at home, an idea of where to start. And every dog is different, like you guys said.
Mhm.
All right, let's see.
I don't know.
Have you
Well,
guys
I'm
had
heating the food up.
Yeah. Have you guys had topics that have challenged you emotionally or reshaped how you think about pet care?
Yeah, I think so.
No,
For me,
cold-hearted.
Chris is like, no, absolutely not. Yeah. For me, always the topics that are around, just like whatever. Yeah. Um, the topics around end of life care or cognitive decline have, having those conversations about those realities, they kind of force you to sit with the emotional weight that comes with, loving an animal through every stage of their life. So that's always a challenging emotional thing for me. And when we talk about chronic conditions or long-term mobility challenges, we're also talking about grief and guilt and caretaker fatigue and resilience, not only of animals, but people. So it kind of changed the way I frame pet care because in end of life I'm not always able to fix a particular problem at the end of life stage, but I can support the human animal bond and I can honor that relationship. So end of life stuff and cognitive stuff is always emotional for me. I think I cried on a podcast that we did one on too. If you go back and listen, I may have
I
cried.
I did. Yeah. It was the grief podcast, but I was talking
May
about
have
my heart
cried.
dog.
Yeah.
And that was a first. But um I guess one of the reasons that I chose to go into physical therapy with people
Mhm.
was due to the relationships that are built in that process. So, I could have maybe gone to med school, but then I realized that, I might see somebody once, I might see them annually, I might see them. And at that time, insurance was more generous. So we were often seeing our patients 2 to 3 times a week. And I wanted to be able to establish that connection, that rapport. And I feel like it's even more so because now we're kind of narrowing down, the audience or the patient population or whatever, even more, and working with people and their pets. And I'll tell you that the compliance that pet parents have with their pets is off the charts better than when I was telling them what to do for their own health and well-being.
I don't want
People
to do
don't
it.
care about themselves, but they
They
care
don't care
about
about
their pets.
themselves.
Yeah. Well, their pets are their kids. To me,
Yeah.
we talk about pet parents and they're like, oh, don't say that. I'm like, when people ask me, how are your kids doing? My first question is, are you talking about my two-legged kids or my four-legged kids?
Right.
Right?
Right.
Because I have
Yeah.
friends who are not pet people that are
Mhm.
truly just asking about my two-legged kids. And I have friends that really don't care about my two-legged kids, but my four-legged kids are super important.
Yeah. Well, and I
Right.
think that's hard to navigate too, like the terminology, because I remember one time I was giving a lecture to a breed group and I used the term guardian and they didn't like guardian. And then when you say owner, it's like, well, you don't own the pet. And then you say pet parent, and then that's anthropomorphizing them. So it's really tricky. And if somebody says something, then I try to, honor what they say. And I'll even say, like I called a dog a pity the other day. And she goes, I don't like the term pity I have an American Pit Bull Terrier. I've owned them since 1981 or something. And I said, thank you, for sharing that. I said, but also appreciate when I'm using the term pity. I think they get a bad rap, and it's a term of endearment for me. And I just got off, I said, I have Cavalier King Charles Spaniels. That's a mouthful. So I call them calves. I have 2 calves. So it's just, I tend to shorten everything or whatever. It wasn't disrespect or anything like that. But I think that things can be kindly shared. And, again, we need to hear, what people want.
Right. Absolutely. All right. Last question. What's going on? What's coming up in the future for PetAbility? Anything that you can share with us?
Chris, anything? Well, I hope to have my 3rd publication out this year. I can't make any promises, but in 2012, I wrote a book called Blind Devotion: Enhancing the Lives of Blind and Visually Impaired Dogs, which is a top resource for clients living with blind dogs, and it's been recommended by ophthalmologists all over the world. And then I followed that up with a children's book about living with a blind dog so that I could educate children on living with a sensory impaired pet. And then I hope to publish soon, which I keep saying every year, soon, just, tips on maintaining your mobility and your independence in your senior dog.
Nice.
Yeah. And we've been working on a new website because we really want to have more freedom to promote things that we believe in than what we can get in the website that simply its sole purpose is to, publish the podcast. So, we've interviewed so many different rescues and organizations, and so many of them are nonprofits, and we learn so much about them. And so we want to give people that opportunity to learn more about them, and if they want to make a donation of any kind, not just financial but maybe volunteering or what have you. So we're working on that, and we plan to just keep chugging away. I mean, this is kind of, somebody asked me in the very beginning when I was learning about podcasting, and they've been doing it for a little while. And they said, so let me ask you this first and foremost, are you in this to make money? And I'm like, absolutely not. And that's good, because we have not made any. I mean, we're hoping, we're hoping to, break even and such through things, you're smarter, Dr. Laurie, with your classes and things that you offer. But, it was important for Cathy and I to just be able to get this information out there. And we recently learned that we're number 6 of all veterinary podcasts that are out there. So
that was exciting.
It's absolutely nothing in terms of marketing or anything.
We didn't know. Yes. We just found that out. Also, don't forget we have that YouTube channel, because we have lots of video tutorials. Dr. Laurie's on our YouTube channel with some video tutorials. And this is a great resource for clients. So when I tell people about how to do passive range of motion, and then they go, what? I go, don't worry, here's the link. Just go here and you can watch us do it and go through the motions and describe it step by step. So I think that's been a value add for our clients to be able to see what that
and
looks like.
Thank you for having us on. Because like I said, we don't do a whole lot of marketing. And so, we were thrilled when you asked us to be part of this live session, and, hopefully get the word out there about PetAbility. So for all your folks that have joined tonight or maybe listening later, please spread the word, check it out. We have just so many great topics. From soup to nuts, as they say. So thank you for having us.
Thank you. Yeah.
So I don't know if you guys saw, but Laura said congrats, and Michelle said thank you so much, Chris, Cathy, and Dr. Laurie, for a wonderful time together tonight. I appreciate each of you. Robin says great to be recognized. Marnie says thank you. Dries says, could you please give us the links that you give to your pet parents? Oh, so if you guys have links that you can share with Christine, that she can put it in for when we push this out to everybody, that's a great idea. Thank you. Laura says,
and are you speaking like when we mentioned Dr. Busby and MedcoVet and that kind of thing? Is that what you're referring to? When you say
I think what you're talking about links is, like you said, you send the links to your people for this is how you do passive range
the tutorials.
Yeah, the tutorials.
Yeah.
So just get that to Christine, and we'll connect that with everything. Excellent session. So thank you, Anna Marie. Melanie says, thank you all. Christine, thank you, thank you, thank you, thank you. So everybody's saying thank you. Thank you, guys. I hope you had fun. I hope you
Thanks.
had a lot.
Yeah.
Thank you, Kathy and Chris, for coming. It's been a lot of fun. And we'll see you in another podcast, hopefully either with you guys or with us. Sound good?
Yeah, that would be
Love having
awesome. And
Dr.
thank
Laurie on.
you
Yeah.
for attending tonight, and keep learning and loving your dogs.
Absolutely. All right,
We
everyone.
did name
Have
it
a great
PetAbility on purpose.
Yes, absolutely. All
All right.
righty.
Thank you.
Thank you, guys.
Thank you all.
Bye-bye.
Thank you. Bye.